we have paced that elevator perfectly, right? So Larry, so you have been so involved in biomedical research. And of course, when you think about science and technology, it's beyond just biomedical research. It's about all that whole spectrum of of science that can, in this case, influence health and how we use them. So if you had those 3 minutes, what do you think are the most pressing challenges and most promising opportunities facing our science and technology and innovation?
Thank you, Victor. So because I'm a science nerd, I'd begin with data, and I would argue that we have to enhance data accessibility, data sharing, and data security. It's the only way we're going to get to this interoperable electronic health record that everybody wants. We have to make sure that all research data follows what we term as the FAIR principles, meaning that it's findable, it's accessible, and that it's interoperable, and then finally it's reusable. That creates some tensions that we'd have to overcome. In particular, the tension between creating a personal health identifier to ensure the interoperability and the need to protect personal privacy. The second ask would be to help facilitate more rapid integration of the best evidence and the new technologies into patient care. Again, not without many challenges. So how do we best integrate molecular guidance, that is, information encoded within an individual's genome, into standard care? The tension that others on this panel are far more facile with between cost containment and the potential value of innovative therapies. Very importantly, how do we retrain the healthcare workforce of today, and how do we train the healthcare workforce of the future? And then communication of what so-called big data results mean to individual patients and to their providers. The final ask would be to help facilitate the increased collaboration among academia, government, and industry. And we have some examples of this where it works very well in the research space, so-called pre-competitive efforts, where industry and the government are able to sit down together with academicians and do things that we were not able to do alone. I think also we have to close this divide that exists between innovators and regulators.
Okay.
So those would be the things that I
Outstanding. So I'm going to later on, I'm sure Mark will push you guys for a little bit more policy details or recommendation, but this is a really good start.